Distinguished participants, partners, ladies and gentlemen, it's a real pleasure to address you today, albeit online. I am very pleased to have met some of you during my trip to Indonesia during the week of 15th July for the WHO Global Youth Town Hall to end TB and the global meeting of the Working Group on Public-Private Mix on TB Prevention and Care. I came back to Geneva very energized and inspired after seeing the dedication and commitment to end TB at all levels in the country. As you may be aware, this is a very special time for the fight to end TB, and we need everyone to stand united. TB is in the spotlight like never before. In September 2018, heads of states came together at the first ever UN General Assembly high-level meeting on TB at the United Nations in New York, under the theme United to End Tuberculosis, an urgent global response to a global epidemic. This follows on from a very successful ministerial conference on ending TB in Moscow in November 2017, which resulted in high-level commitments from ministers and other leaders from 120 countries and over 800 partners, including civil society, to end TB. We have the highest political commitment. Now it's time for action. Indonesia's health minister, Honorable Professor Nila Merlik, was at both high-level events. While we have made progress against TB with over 54 million lives saved since the year 2000, the burden of suffering and death due to TB remains immense. TB is the world's biggest infectious killer. Last year, more than 10 million people fell ill with TB, and 1.6 million people lost their lives. Indonesia is among the top 3 with the highest burden of TB, but in the same time making good progress in tackling the disease. I was very impressed by the leadership in the country, starting from the highest level with the office of your president, with TB included as part of the minimum service standard for districts. Your health minister, who joined and addressed both the WHO Global Youth Town Hall to end TB and the global meeting of the Working Group on Public-Private Mix on TB Prevention and Care. And Dr. Imran Pambudi, your National TB Program Manager, who is leading efforts to end TB and breaking the trajectory of the epidemic in the country. It was great to meet with the provincial heads, visit hospitals and health centers in Jakarta, meet with TB survivors, civil society and partners, as well as see up close the drive and energy of your youth, who are excited and want to be part of end TB. Following these visits, all 150 participants from across 20 countries met to do a deep dive on the models in place in the country, including on health financing, insurance, private sector engagement, and to listen to the voice of TB survivors. The meeting that you are in is very important to translate global commitments to actions on the ground. I urge you to work closely together to be the pathfinder and model for other countries, regions, and the world in accelerating the TB response and reaching targets. I would like to close with the words of our Director General, Dr. Tedros. In the end, we must remember that the war against TB will not be won at meetings in Moscow, Delhi, or New York. It will be won in communities. It will not be won with declarations. It will be won by nurses, doctors, community health workers and others at the front lines. Our job is to give them the resources they need to find every last person with TB, to diagnose them, to treat them, and to cure them. That's the measure of success. Our success depends on you and your work on the ground. We stand committed to taking forward the next steps coming out of these important workshops. Together we can end TB. It's time to make TB history. I wish you all the very best. Thank you.